Live. You may have heard just before our news headline bulletin, we gave you some scary statistics and also some inserts of World Stroke Week, and focusing on some people that have survived and are living a good life after having a stroke. But how do we prevent that from happening? So World Stroke Week is being marked to raise awareness about the symptoms of a stroke and the importance of taking treatment for recovery. According to the Heart and Stroke Foundation of South Africa, strokes claim nearly 70 lives a day in South Africa. They occur when the blood supply to part of the brain is cut off, and without blood, which carries oxygen brain cells, it can be damaged or you can die. Depending on which part of the brain is affected and how quickly the person is treated, the effects of a stroke can be devastating to a person's body, mobility, speech, as well as how they think and feel, and many, many other after effects. So to talk more about World Stroke Week, we're joined in studio by Professor Feroza Motara, who is Academic Head of Emergency Medicine at Wits Faculty of Health and Sciences, and also is the Head of Emergency Unit at the Charlotte Maxeke Johannesburg Academic Hospital. Prof, thanks for coming in. Welcome to Morning Live.
Good morning. Thanks for having me.
Devastating statistics. Is this what it is? 70 people die every day from a stroke.
Well, the current statistics that we have says we have about 132,000 strokes a year.
Yeah.
Which equates to about 1 in 6 minutes continuously throughout the country. It's related to our high rates of high blood pressure, diabetes, obesity, high rates of smoking, excessive alcohol intake, and basically a lifestyle disease, pretty much like you would have a heart attack, you have a brain attack.
Yeah. Is there any way of telling whether you are going to have a stroke or not?
So there are risk factors. Some are modifiable, some not. So there is an inherited risk. Your gender is a risk. Which country?
When you say your gender, where is it more prevalent, in women or men?
It depends. In certain instances, more frequently in women.
Yeah.
But generally more men, especially in the age groups between 40 and 80.
40 and 80.
Then there are non-modifiable risk factors such as, modifiable risk factors, such as high blood pressure, diabetes, obesity, high cholesterol, which essentially are lifestyle disease things that can be modified by the way we behave, the way we eat, what we abuse or not.
Yeah. So those are the things that can cause you to have a stroke.
Yes.
But now, I think what's important is so many people actually do not realize at the time that they're having a stroke. What do we look out for? I mean, if I'm suddenly sitting and talking or doing a normal activity, and I start feeling strange, what are those symptoms you look out for?
It largely depends on the area that is being affected in your brain. But generally, we say to, the layman out there, it's focal neurology. Essentially, that means you have slurred speech, you have weakness in one or more limb or both limbs, you have changes in vision. We use an acronym called FAST that we put out, and that essentially is facial weakness or drooping on one side of the face, arm weakness, so you say to the person, lift your arm, and they're unable to keep them both up, and slurred speech. Those are the common ones that would be seen. And then the last letter in that acronym is T, which is essentially time. And, like you would have a heart attack, and time is tissue, with a brain, what we call a brain attack or a stroke, essentially the same thing. You lose about 2 million brain cells for every minute that treatment is delayed.
For every minute you're using that many brain cells.
So that's huge. Yeah.
The reality is that, I mean, some of the symptoms that you have said here, they appear to me, a layman, to be very similar to a heart attack. Is that really, I mean, they seem quite similar.
So exactly the same mechanism in terms of cause, the same pathology, the same underlying issues. in terms of that it's a vascular disease. Blockage of an artery or vessel in the brain that's supplying oxygen and nutrients to the brain tissue gets blocked, and that causes a cutoff of supply to that area of the brain. And as I said, every minute that gets that clot is obstructing that vessel, progressively increases the loss of function.
In other words, get medical care as soon as you can.
Yes.
Get medical care. That's
absolutely. Just to reiterate that there is another kind of stroke, which is called a hemorrhagic stroke, and that occurs as a result of a bleed in the brain. Usually it's associated with an underlying abnormality in a vessel, with an underlying high blood pressure that would cause that blood vessel to burst and then cause a bleed in the brain, but produces essentially the same symptoms.
Just finally, I mean, there are a lot of people, obviously, that have already had strokes. Is there, if you have had a stroke, is there a risk you may have another stroke? Is your risk higher?
There's a higher risk. There's at least a 5 times higher risk that you could have a second stroke.
Yeah.
Obviously, it would involve lifestyle modification, taking treatment for the high blood pressure, controlling the diabetes, and making sure that those are associated with regular follow-ups, regular medication, regular checkups.
Yeah. So you got to really lead that healthy lifestyle. We had an interview talking about diabetes yesterday, and this is exactly the same. It's the lifestyle, it's what you eat, it's how you look after yourselves. I don't think it can be emphasized enough. Thank you for talking to us.
It's a huge pleasure.
Thanks for raising awareness here on the program. World Diabetes, or not diabetes, I beg your pardon, World Stroke Week that is happening now. So be aware, get health checks, and have a healthy lifestyle. Talking to us, Professor Feroza Motara, the head of emergency medicine at Wits Faculty of Health. Let's take a break.